Is delayed cord clamping the best option for our babies? Or is this just another passing trend? Spoiler alert, it is not a trend. This is something that has been researched and debated for a very, very long time. But for some reason, we are still doing outdated routine practices in our hospitals and are giving women a lot of pushback for doing things that are actually biologically and physiologically beneficial for our babies. Delayed cord clamping can save a baby's life. It can decrease baby's risk of future complications, and it's because of this really amazing organ that your body has created simply for pregnancy called the placenta. The only difference in why it feels like a trend right now is that women are starting to become aware of it. They're starting to become aware of the benefits and their options, and now we're talking about it. Hey mama, welcome back to my channel. My name is Chanel. I am a mama of 3, wife, believer, and doula, and I just love to help women and families go from a place of feeling really overwhelmed, unsure, confused, to going to a place of feeling really empowered and confident and excited about going into birth and having the tools to do that and transition into the motherhood journey and experience in a positive way. So if that sounds like something that you're interested in, make sure to hit the subscribe button below. I would love to have you join our community and give you all the tools and tips that you need to know, honestly, from the time of conception until, well, never, because motherhood never ends. If you want to know the truth, you have to learn about it. You have to understand it. So in this video, I'm going to break down the truth about delayed cord clamping. What does the evidence say? What do experiences say? And is this really worth considering putting on your birth plan? And to give you a little history lesson really quickly, in 1801, Erasmus Darwin wrote, "Another thing very injurious to the child is the tying or cutting of the navel string too soon, which should always be left until the child has not only repeatedly breathed, but until all pulsation in the cord ceases, as otherwise the child is much weaker than it ought to be." Now, if we dive into those quotes alone, we can see already very early on, there was a common understanding of the benefit of keeping the baby attached to the cord as long as possible, or at least until it stops pulsating, because of the outcomes and the benefits for the baby. And since then, we've seen an immense number of studies that actually support this. So what is delayed cord clamping and what is the science behind it? Delayed cord clamping is essentially just allowing the baby to stay connected to the umbilical cord as long as there is still blood flowing and pulsating in the cord. And what that does is it allows billions of red blood cells, stem cells, white blood cells, and other nutrients to actually pass to the baby until all of that has flown from the placenta to the baby. Now, there's a ton of benefits to the baby that we're gonna break down in this video. But let's start with what is the ideal time, because that's obviously what we're all talking about, is what is delayed cord clamping and how long should I actually delay? In hospitals right now, the routine practice is delayed cord clamping is 30 to 60 seconds after the baby is born. Y'all, that is not delayed. That's just enough time to get the baby to mom's chest and process now that we have an additional human in the room with us. Of course, depending on who you ask, somebody may say that is delayed, some people may say that is not. We're gonna actually break down what does ACOG actually say and show from research is beneficial time-wise and what the baby gets at each stage of the delay to know what is best for your baby. At the 1-minute mark, baby actually receives 50% of the cord blood. At the 3-minute mark, baby will receive up to 90% of the cord blood. And at around 5 minutes, baby will get all of the necessary cord blood and nutrients from the placenta. Now, they also do say exact times may vary, so it is best to cut the cord when it is white, limp, and no longer pulsating. That means that could be at 4 minutes, that could be at 5 minutes, that could be at 10 minutes. It varies baby to baby, mom to mom. So if we're just following ACOG's recommendations here, that is all we need to know, is that if we can wait until it's white, no longer pulsating, and the cord is limp, that is a good rule of thumb to move forward with when it comes to actually deciding on the time that we want to cut the cord. So then why are so many medical providers still insisting on cutting it earlier? There's a variety of reasons and a lot of controversial topics out there, but let's talk about the biggest reasons that people are still cutting the cord quickly and giving moms pushback to why they should keep this cord attached to the baby longer? Well, for one, some people think that 30 to 60 seconds delayed is long enough and enough blood volume and stem cells to transfer to your baby, and they think that that's enough. But what we've seen here is that 50% versus 100%, that's a big difference. Depending on where you fall on that line, that will determine whether or not you feel like additional time past that 1 minute mark is beneficial for your baby. There was also once a fear that actually keeping your baby attached to the placenta longer would cause the blood to actually return to the placenta. And we have plenty of studies proving that that is actually not true. The umbilical cord is actually created and formed with this thing called Wharton's jelly. And what Wharton's jelly does is protects the cord from kinking and knotting. So when you hear about nuchal cords or the cord wrapped around baby's neck, usually that's not something that we need to be concerned about for our babies unless our baby is showing signs of fetal distress. And the reason that that is because if you look at Wharton's jelly and you look at the umbilical cord, a cord could be in a knot and the blood is still flowing because of how it's been created. So unless that cord is in a super, super tight knot, which is extremely rare, we don't usually see concerns or problems because of a nuchal cord. Many babies, about a third of babies are actually born with nuchal cords. So one of the things that the Wharton's jelly does is it prevents the flow from actually stopping or getting caught up because of a tie or a knot. One of the other really cool things that it does is when it is exposed to extreme temperature changes, which obviously going from inside of the body to outside of the body, there is a very major extreme temperature change. It begins to expand and actually shuts off those tiny little arteries, which means that there's no blood that's going to escape your baby and come back to the placenta after the blood flow to the baby. Another concern that is brought to women's attention when it comes to delayed cord clamping is jaundice. In the literature and research right now, when it comes to jaundice, there is showing some studies, not all, some studies that show a slightly increased risk of jaundice for your baby. However, that risk is not across the board, and it's also not significant enough to say that delaying the cord clamping is significantly causing an increase in jaundice. So while that is a concern and providers are going to let you know that information, the truth is it's not a significant enough effect or causation to be able to say that if you delay cord clamping that your baby's automatically going to get jaundice. Lastly, there also have been conversations about whether or not delayed cord clamping can increase mama's risk of hemorrhaging. Evidence showed that delayed cord clamping was not associated with an increased risk of postpartum hemorrhaging or an increased risk of blood loss at delivery. So what are the actual benefits of delayed cord clamping and why should you do it? Benefit number one is increased levels of iron. The additional blood flow from the placenta to the baby provides adequate amounts of iron for your baby. This extra iron has been shown to prevent iron deficiency in the first year of life for your baby. Now, if you don't understand the impacts of having a baby that is deficient in iron, there are serious side effects and concerns that can happen to your baby if they're deficient in iron. And one of the things that most people think is that, oh, I can just give my baby iron drops. That is not going to effectively solve the issue. When your baby gets that additional iron supply from the placenta, the thing that's been fueling and keeping them growing and developing over the last 9 months, that iron supply given to your baby at birth actually has positive outcomes for your baby's development long term. Positive motor skill development, cognitive skill development, and behavioral skill development for your babies. On the contrary, being deficient in iron actually has effects, negative effects on cognitive development, brain development, motor development that sometimes is irreversible. Benefit number two is more oxygen for your baby. As long as that placenta is attached to the uterine wall after birth, it's going to continue to provide oxygen for your baby, as well as nutrient-rich blood that's going to help with that transition earth side for your baby. One study actually showed that babies who had delayed cord clamping had a higher red blood cell count volume than those who didn't. Benefit number three is it can save a preemie's life. Y'all, if that's not proof enough that this process of delayed cord clamping is so powerful, is that it can actually save a preemie's life. A lot of times when preemies are born, you see them on baby or mommy's chest for a very, very short period of time, and then they're taken straight to the NICU. In a very few points is somebody even thinking about delayed cord clamping because everything feels so emergent. But when those cords are cut prematurely, that can lead to greater risk for that baby. Some of those risks include heart problems, respiratory problems, lower blood pressure, more need for oxygen and ventilation, increased risk of anemia, increased risk of infections. So allowing your baby to stay connected to the cord, even in a preemie situation, can do so much for these babies. Delaying the cord for even preemie babies for even just 1 minute has resulted in reduced mortality by 1/3. I don't know about you, but that is very significant. That is very significant. A 60-second shift or pause can save 100 more babies. That is something that needs to be paid attention to. And that's something that all parents deserve to know so that they can advocate for that in their delivery if they're in that situation. But unfortunately, a lot of providers are not leading with that, nor are they thinking about that, nor are they using that evidence-based material in practice to help save a baby's life. So this thing here is not a fad. It is proven, evidence-based, and life-saving. The fourth benefit to delayed cord clamping is the stem cells that actually come from the blood. Stem cells play a huge role and benefit into immunity, the central nervous system, respiratory and cardiovascular functions in our bodies to help support with the functions at the very beginning of their lives. And benefit number 5 is increased blood volume. This blood is really rich with those stem cells that we just discussed. And what that does, it actually helps the cellular structure that will actually carry them through for the rest of their lives. We talked about the developmental benefits. We've talked about the actual iron benefits that help with the developmental structure. We've talked about the stem cells and how that creates immunity and respiratory and cardiovascular benefits for the baby long term. And the blood volume does that. That is exactly how all of this happens. And if we cut the cord immediately, that could deprive baby of up to 40% of their blood volume, which could have a lot of negative side effects and long-term risks for our baby's overall health and development. And one big misconception is that if I have a C-section, none of this really applies to me. Depending on the situation of your C-section, maybe something is more emergent and we absolutely have to get baby out right away. But in many C-sections, delayed cord clamping is still an option for our babies. And the way that that is done is by milking the cord. Even in the event where a baby needs immediate attention for resuscitation or for the C-section, milking of the cord is an option. By simply milking the cord, where the provider will actually help push that flow to your baby through the cord, had higher levels of iron just 48 hours after birth. And mama, even if you are anemic, this does not mean that your baby is not going to get adequate amounts of iron through the placenta. Babies of anemic mamas who actually had their cords cut immediately showed rates of anemia 7 times higher than the moms who were anemic and had their cords milked or did delayed cord clamping. So mama, yes, we want your iron levels to be great and we need to take care of those things. However, just because you're anemic does not mean that your baby's going to be anemic. It does. So as you can see, there are a ton of benefits to delayed cord clamping for your baby's overall health and development. I hope this information serves you well and helps you feel more informed about making the decision that you need to make and advocating for that. What's important that you do right now is that you think about, what does this look like for me? How do I want to advocate for this? How do I want to put this on my birth plan? And what conversations do I need to have with my provider right now to make sure that I can have my baby connected to the cord as long as possible? Have this conversation with your provider at your next appointment. Ask what their particular thoughts are on delayed cord clamping. How do you need to advocate for this? One rule of thumb that I like to tell my clients is that if you can, instead of even thinking about it, because you're going to be so enamored with your baby that you're not even paying attention to somebody down at the bottom paying attention to your cord and delivering the placenta. What you can do is that you can ask and request that the cord is not cut before the placenta is delivered. And in that case, you are probably getting yourself to a good position where that cord is no longer pulsating and is white by the time that your placenta is delivered. That doesn't happen for everybody, but if you use that rule of thumb, you are gonna buy yourself a lot of time. Sometimes our cords are gonna be done pulsating in 3 minutes, and then maybe you're fine cutting that. But partners, this is also one of those things that you have to pay attention to so that you can honor and advocate for your baby's overall health benefits from keeping that cord delayed. Nothing should be clamping the cord even to deliver the placenta. That can be done simply with a provider's hands. So making sure you're paying attention to that, having these conversations now and speaking up on the day of to ensure that your baby has the best overall outcomes and health benefits now and long term. So now I'm curious, what part of this surprised you the most? What do you feel like is keeping you concerned, or what is it pushing you towards now that you've learned a little bit more about this information? Does it make you want to do it? Does it make you really not care or make a difference? I'm curious, so let me know in the comments below. And if you've experienced this before, let us know how it's worked out for your baby as well. All right, y'all, that is it for me. Thanks for sticking around for this super long and informative video. I hope that you got everything that you needed to know your options and rights, and so that you can give your baby the best outcome possible. I will see you on the next video.